All right. According to my clock, we are at the top of the hour, so I will get us underway, and then I'll be quickly moving to make sure we get everybody's audio connected. I just want to start out today at first, and I'll say it, my name is Sarah Crass, and I am part of the PMNCH Virtual Partners Forum Organizing Committee. I also work with World Vision International, who's hosting this PMNCH forum that's today. And today I'm very excited that this is the 5th in our Virtual Partners Forum webinar series, and we're talking about the purpose and plan for PMNCH today and moving forward. So why are we all in partnership or thinking about partnership with PMNCH, and we'll be diving into that topic today. This is the time number 1 of this webinar. We'll be hosting this again in about 8 hours. So thank you for being our first participants in this conversation, and we look forward to interacting with you today. You will notice that you were automatically muted when you came into this webinar. And that's simply so that the background noise stays very low while our presenters are going through their talks. But while you are muted, we don't want you to be silent. We have got this chat box, which you will see right below the names of participants on this webinar. And we would love for you to use this chat box to ask questions of our participants. Our speakers today have worked with PMNCH for years, and they're here to make sure that your questions about PMNCH are answered, and so that you can learn more about how to become a more active partner within PMNCH. So please use that chat box to type your questions during their presentations, or you can type comments if you have other experiences like theirs to share. Just remember to send to box that it gets moved to where it says everyone, so that we can all see the questions that you have, and we can all interact with one another. So just so that you get familiar with the chat box, please do as Sheila has just done and introduce yourself via the chat box, and that would be really great so that we can get to know who you are, where you're calling in from. I know one of our earlier people came on, so Allison, I know you've already introduced yourself once, but for new people who are coming on, please go ahead and introduce yourself again so that everybody can also get to know you. So today, you'll get to hear next from one of my co-organizers on the Virtual Partners Forum, who's been working with me in engaging all of our partners. So Sheila Manji is part of the PMNCH Secretariat. She's an ECD specialist and a technical specialist and consultant with PMNCH. So Sheila, why don't you talk us through a little bit as to what we're doing here in this Virtual Partners Forum?
Great. Welcome, everyone. Good evening, good morning, good afternoon, wherever you are. This is, as Sarah said, our 5th and final webinar of the webinar series. This year, as part of the Partners Forum that will take place in Delhi next week, we organized a number of virtual events that allow you and those of you that are curious or interested in what's going to be happening at the forum to get to know a bit ahead of time. But also, if you're not able to attend the forum, to have ways to engage with us from afar. So the webinar series and the virtual side events are 2 things that have been happening in the lead up to Delhi, and the live streaming and the Meet the Panelists are 2 activities that you can look forward to seeing when we're in Delhi on the 12th and 13th. The webinar series, this was developed in conjunction with the co-chairs of the different working groups that are developing the program for the Partners Forum. There is 4 themes: multi-sectoral collaborations, accountability, power partnerships, and political leadership. And for each of the webinars, we had a few different speakers just touch on some of the issues that are going to be explored in Delhi. If you missed any of those webinars, you can go visit partnersforum2018.com, click on Virtual Forum, and then the webinar series. All of the recordings are there. We wanted to use this webinar series as an opportunity to also help, as Sarah said, you understand what is PMNCH, what is it all about, what are the opportunities for me to get engaged. And I know a lot of you have been asking questions through your registration about, what does it mean to be a partner, and how can I become a partner? So we hope to address some of those questions today. We want to say a really big thank you to World Vision International for hosting this webinar series with us. And especially to also all our co-chairs and our speakers across the series who have really, really come together to make this possible. So we're going to jump ahead in the slides to our webinar of today. So we have on the line Sarah and myself. We'll be taking you through the webinar for today. We will play more of a background facilitation role, making sure that you know your speakers, know what we're doing, and helping you with the Q&A at the end of the session. Our speakers today, we have 3 speakers, very, very highly experienced speakers in their own rights, in their own careers, but also with respect to their knowledge of the Partnership for Maternal, Newborn and Child Health, its history, have played different functions as part of this partnership, and have different things to share with you from their own experiences. So we're going to start, I'll just introduce the 3 speakers and then I will hand over so we can get right into things. We have Anne Stars with us, who is a widely recognized expert and advocate for gender equality, women's rights, and reproductive and maternal health. She currently serves as the co-chair of the Guttmacher-Lancet Commission for Sexual and Reproductive Health and Rights. From August 2014 to October 2018, she served as the president and CEO of the Guttmacher Institute, a leading research and policy organization dedicated to sexual and reproductive health, which was an organizational recipient of the United Nations Population Award in 2018. Prior to joining Guttmacher, Ms. Stars was president of Family Care International, a non-governmental organization working to improve reproductive, maternal, and newborn health in low-income countries, which she helped found in 1986. She has been on the board of the Partnership for Maternal, Newborn, and Child Health since 2005, serving as co-chair from 2005 to 2011. And as you'll learn, Anne will tell us the history of the partnership, how it came to be, and also later in the webinar share more with us about her experience as she has worn different hats in her time with the partnership. Ms. Helga Fogstad is our Executive Director for the Partnership for Maternal, Newborn and Child Health, PMNCH. I'm going to stop using the long name and switch to PMNCH now. And she has a wealth of experience in RMNCH-related issues. She has been working in public health for more than 30 years in developing countries at subnational and national levels, as well as at international levels with multilateral and bilateral organizations. Prior to joining the partnership, she was the director of the Department of Global Health, Education and Research at the Norwegian Agency for Development Cooperation. She's also been responsible for NORAD's portfolio on global health and was responsible for providing technical and strategic advice to Norway's effort in strengthening and accelerating coordinated action at global, regional, and national levels to promote rapid scale-up of proven cost-effective interventions with special focus on the health of women and children in the center. So she has a number of different roles that she's played over the years that have led to different kinds of partnerships or influenced different kinds of partnerships, and she brings that expertise to PMNCH. And our third speaker, who we'll hear about much in the second half of the webinar, is Gongon Lejang Falani, or Gigi, who is a philanthropist and a development practitioner from Botswana. She is the founder and executive director of a non-profit-making non-governmental organization called the Gongon Lejang Falani Pillar of Hope Organization, which is a member of the UNFPA African Youth and Adolescent Network. Gigi has been a member of the, well, not just a member, but also the lead now of the Adolescent and Youth constituencies. So as we talk to you today about how PMNCH is structured and how we work with different groups, you'll hear that one of those groups is the Adolescent and Youth group, and that is the one that Gigi leads on. So I'm going to stop there because I'm sure as we get to know our speakers, we will hear more about what each of them brings to PMNCH, what kinds of experiences they've had with PMNCH, and also where you come in. So I'm going to hand over to Anne, who will take us through why PMNCH, how it came to be, and then she'll hand over to Helga to tell us more about where we're headed and what's coming up in the next few years.
Great. Thank you, Sheila. Really appreciate that introduction and learning a little bit more about even people I've known for some time. So to start us off, I'm going to take us through a number of slides that, as Sheila said, provide an opportunity to give the background and quick introduction of PMNCH. Oh, let's see. Trying to move the slides.
You should be able to move.
Oh, that's right. It's up at the top. Yeah. I'm sorry. Yeah. Temporary brain freeze since it is 1 o'clock in the morning for me. All right. So I'm going to give, as Sheila said, a quick history of the partnership, then an overview of its structure, the objectives, and then a little bit about the structure and governance. The partnership was established or launched in September of 2005. It has a secretariat, as you know, that is based at the World Health Organization in Geneva. What not everybody may know or may remember is that PMNCH emerged from essentially the merger of 3 pre-existing partnerships. There was a partnership for safe motherhood and maternal and newborn health, which was hosted by the organization that I ran previously, Family Care International. There was a Healthy Newborn Partnership hosted by Save the Children USA, and then the Child Survival Partnership, which was hosted by UNICEF. So as you can see, these 3 partnerships focused on what were then the 3 elements of the continuum of care: maternal health, newborn health, and child health. Donors, UN agencies, and others essentially looked at this and said, these are all very interrelated issues. Does it make sense to have 3 separate partnerships with 3 separate secretariats, 3 separate boards, when in fact there is so much interconnection and interdependence between these 3 issues in these 3 communities? So they encouraged these 3 partnerships to merge. And that is what led to the establishment of PMNCH, focused, as the slide says, on MDGs, what were then the Millennium Development Goals 4 and 5, on reduced child mortality and improved maternal health. Over the years, the partnership shifted its focus from being primarily on this maternal, newborn, and child health element of the continuum to taking a broader continuum of care or life course approach. So issues of reproductive health, recognizing the importance of reproductive health to the survival and well-being of women and children, led to the initial addition of reproductive health to the agenda, which then expanded, also recognizing the crucial importance of nutrition to, in particular, both child health, but also, of course, newborn and maternal health. And then the sexual health element also came in, recognizing, again, the interdependence between sexual reproductive health and then the maternal and newborn and child health. I'm going to skip over a fair amount of what happened in the first 5 years of the partnership, but just to note that there was a substantial external focus to what PMNCH was doing, in particular focused on getting high-level, high-visibility policymakers and celebrities on board for the agenda. So there was a strong focus on advocacy, in particular, to raise awareness of the partnership and its mission, of the importance of maternal, newborn, and child survival. And there was also a strong focus on, of course, resource mobilization, working with the Government of Canada on the Muskoka Initiative, working with Sarah Brown, who was then the wife of the Prime Minister of the UK, who was very involved in particular, the maternal health element. There was also a substantial amount of work that was being done during this time, these first sort of 5 years of the partnership, to analyze what were the factors, the interventions that could save lives across this life course or continuum of care, to understand the scope of the gaps that we were facing in low-resource, low-income countries, and also to understand which were the most effective interventions, and to understand these interlinkages. How were maternal, newborn, and child health interdependent and interconnected? A lot of this work came together in 2010 when PMNCH played a crucial role, working in very close collaboration with the Secretary General at the time, Ban Ki-moon, to develop what became the global strategy for maternal and child health. That global strategy really helped to bring a strong focus to PMNCH's work, working in collaboration with a range of partners across the constituencies. That work was very high level, high visibility, and high impact from that period 2010 to 2015. And then in 2015, PMNCH also played a crucial role in developing the updated or new global strategy for what was then became women's, children's, and adolescents' health. So one of the things that you saw happening over those 5 years was the emergence of a strong focus on adolescents' health, recognition of the importance of adolescent health and well-being to the overall agenda. So very briefly, as of December 2018, as of today, there are over 1,000 members in the PMNCH family from 192 countries and now 10 constituencies. This chart shows the growth of PMNCH membership from 2009 to 2018. So I see the exact number is 1,040 members at this time. Each of the 10 constituencies, and I'll go through what the 10 constituencies are in the next slide, has a chair from among its members, an organization and an individual who represents that organization, that serves as the primary representative for that constituency on the PMNCH board. The constituencies vary significantly in size. I'm not actually sure of the numbers, but I'm sure that the NGO constituency is probably, it's historically been about half of the membership. So you have, 400 or 500 members of the NGO constituency. The donors and foundations constituency is much smaller. The global financing mechanisms, I think, currently has just 3 members. So you can see there's a wide variation in the size of the constituencies, and there therefore have to be different mechanisms for communication and exchange and engagement across these different constituencies. Any member of the partnership can engage with PMNCH in a number of ways. Obviously, there's the kind of more passive engagement of receiving e-blasts from the partnership secretariat. Engaging in some constituency discussions is a slightly more active level of participation. And then there's also engagement in some of the PMNCH issue-specific working groups. These can be on different thematic priorities, for example, early childhood development, sexual and reproductive health and rights. Some of the working groups focus on short-term tasks, and some focus on specific events. For example, there's a program advocacy and communications subcommittee for the Partners Forum. There's also technical working groups. For example, there's a working group on tracking ODA and domestic financing for our set of issues. So you can see there's a broad range of opportunities and ways to engage in PMNCH's work. The PMNCH Secretariat, which, as we said, was based in WHO, facilitates that communication and engagement of the constituencies and manages the implementation of the PMNCH work plan and budget, which Helga will be talking about in a few minutes. So this slide lists the 10 constituencies. On the left-hand side, we have the Academic Research and Training Institutes, Adolescents and Youth, the Donors and Foundations, Global Financing Mechanisms, the Healthcare Professional Associations, and on the right-hand side, we have the intergovernmental organizations, NGOs, partner governments, the private sector, and the multilateral agencies, which was known as the H6 but has expanded. As you can see, what we've been doing through PMNCH is bring all these different constituencies together around the core mandate and the core vision of PMNCH. What is that mission and vision? This is The PMNCH vision reflects and echoes that of the Every Woman, Every Child movement as defined in that global strategy for women's, children's, and adolescents' health that I mentioned earlier. A world in which every woman, every child, every adolescent in stable, fragile, and humanitarian settings realizes their right to physical and mental health and well-being, has social and economic opportunities, and is able to participate fully in shaping prosperous and sustainable societies. PMNCH's mission, and its core added value is to increase the engagement, the alignment, and the accountability of partners by providing this multi-stakeholder platform that supports and monitors implementation of the global strategy. One of the key principles of PMNCH is the partner-centric or partnership-centric approach, which is that PMNCH engages in activities and initiatives where the partnership can by bringing more players, more actors, more organizations into the work, that adds value, that expands the reach, it strengthens the credibility, it adds new knowledge or new opportunities to the work. So in other words, PMNCH doesn't do things that individual members of the partnership could do as effectively or perhaps even more effectively on their own. That focus is on the value added. The partnership's focus in those four what we call the 4 A's for alignment, analysis, accountability, and advocacy. And again, Helga will be going through some of these when she goes through the PMNCH business plan. But those 4 areas really very succinctly summarize how and what the partnership does that adds value to the overall work of the community, of the broader community. That survive, thrive, and transform, those are the core targets of the global strategy of the Every Woman, Every Child movement. And down here at the bottom of this slide, we have a quick visual summary of what we call the life course approach. The goals, the life phases, we go from pregnancy, childbirth, and the newborn period to early childhood, to later childhood and early adolescence, then later adolescence and youth, early and middle adulthood, and later adulthood. So these are part of what PMNCH has done in collaboration with UN agencies and other partners, is to define and understand the parameters of these different phases of life, but also to highlight how interconnected they are. One of the key aims that PMNCH is working towards now, that again you'll see reflected in the work plan, is around universal health coverage and promoting the centrality of the PMNCH continuum of care, that life course approach, that focus on women, children, newborns, and adolescents, and how vital it is to achieving the overall aims of universal health coverage. Just quickly, looking at the mandate, a little bit about the structure of PMNCH. The PMNCH board has 2 main focus tasks or areas of responsibility. First is to support and give voice to the Every Woman, Every Child movement, to speak for the issues across the women's, children's, and adolescent health spectrum, and provide a space, a platform for building consensus and cohesion around key priorities, around key messages. The second core area of PMNCH board's work is to govern and oversee PMNCH as an organizational entity. So the PMNCH board has responsibility for defining a strategic vision, approving the strategic plan for PMNCH, and overseeing the execution of the business plan and the budget. I think that's it for my slides at this point, so I will turn it back over to Sarah, who I think will turn it then over to Helga.
Yes, I will. Just queuing up Helga so that you can now talk more about what is PMNCH business plan moving towards 2020. Helga, you now have the presenter ball. I'm going to unmute you.
Thank
So
you.
start as you are ready.
Thank you so much, and good morning and good evening to all. I would like to then start my presentation by saying that I'm so happy to be here and with you on this really important issue. My outline is that I will first address a little the PMNCH value proposition, and then the business plan that we have newly got approved by the executive committee, our theory of change and delivering on this business plan, and then more on the partner engagement. As Anne has highlighted also, some of our functions in PMNCH are really around what we call 4A's. This is really building on the principle that our thousands or more members can come together and do more together than alone. And there are functions focusing on analysis, and that means we don't generate knowledge because many of our partners do that. But what we do is we synthesize knowledge in order to understand the future better and to carve out how we need to then really mobilize strategically together to meet the future for women, children, adolescents, or what we need to synthesize of evidence to make it more powerful in our advocacy or our accountability. The other is alignment. So this is the issue of that we take this knowledge and we really align powerfully together so that there becomes much more leverage together than we would if we were only alone. We have advocacy, which is common advocacy, and a lot of our advocacy has been very strategic, both in sequencing in time or in sequencing on theme, and also on each other. The last bit is accountability, and this is an area that we've then increased in order to say, okay, what is it that we need to call out, what is it that we need to do better, and our mechanisms for not only monitoring but reviewing and also creating platforms in order for dialogue to really take the evidence to date and the progress or non-progress and discuss it for action has been much greater. My next slide shows how the PMNCH has a part in the Every Woman, Every Child architecture. PMNCH is, as Anne said, established by the UN Secretary General in 2010. It has, in the core architecture, it has a country leadership at its center with the multi-stakeholder engagement. The multi-stakeholder engagement and platform is very critical to us because we in PMNCH insist on that including all different groups of stakeholders and not only some members like government and development agencies and the multilaterals, but that it has room for civil society, there's room for the private sector, and so forth. So that is really important to us. We recognize in the Every Woman, Every Child architecture that the H6 and development partners have an important role in supporting country planning and implementation efforts. And then there is the financing for women and children and adolescent health, which includes the Global Financing Facility, but also others like Gavi, Global Fund, and so forth. So you see this the picture on the right depicting then our 10 constituency members, each one playing an important role, an important wheel, but more powerful coming together in order then to create really strategic change. The key achievements to date, and I'll come a little bit back to this in my testimonial too, is giving voice to over 7,000 organizations worldwide that were actually consulted, and all of that process was organized and was taken care of by PMNCH in order to really create ownership and really common direction from all of these organizations. And one did that when one was going to renew the global strategy in 2015 to start the new era of the SDGs, which was then 2016, and will lead us to 2030. So we then helped secure global agreements between the 192 member states, not only during the World Health Assembly, but also during the UN General Assembly. We have also been actively working with a number of our partners to secure resolutions, both in as it relates to with the Parliamentarian Union, but also in different resolutions, as in the Women's Commission, as well as the Population Commission, and also WHA. So what has this led to? We've also looking at back at the global strategy and what it has really mobilized. It has to date mobilized over 650 commitments. It was calculated that without this common movement, that one was able to really increase the financial contribution to women, children, and adolescents with approximately $45 billion that were dispersed. So we had approximately 60 billion, but 45 were then calculated to be dispersed. So no other partnership has the breadth, depth, and diversity of PMNCH, and this is really with the history that Anne has given, that even within PMNCH, even within the community, one didn't really want to only advocate for saving newborn lives or safe motherhood, but one came together, and that I can't tell you what a big commitment that is, that actually partners are willing to relinquish their own partnership in order for the bigger and larger and more strategic good. So we have our business plan within the SDG and also the Every Woman, Every Child framework. We have the global strategy, which is the 2016-2030. We looked very seriously in that, and what that told us is to focus on the unfinished agenda from the MDGs, and that was very much areas that we hadn't progressed enough within in the MDG era. It was on equity, that was on quality, that was really on rights, that was focused on specific areas such as early childhood development, areas related to adolescents, areas related to humanitarian and fragile settings, and also SRHR. So what we've done is there was a strategic plan that was developed for a 5-year period from 2016 to 2020, and then there was 2 sets of a business plan, with 2018 being a common and transitional year between the 2 business plans. And the 2 business plans look very different. The first one works really on strategic objectives, whilst the second one is much more in line with the EVEC focus areas, 6 focus areas, and the shared deliverables, and is much more result oriented. There's been agreement by the EC that our future annual plans, there will be no separate annual plan, but rather to take the business plan and to roll it. So what we will do is that every year we will indicate what we have accomplished and what we are adjusting for the future remaining years in the plan itself. What we envisage will happen next year is that our external evaluation will start and will pretty much happen for the entire 2019, so that the findings of the evaluation are ready for the 2020 year, which we will then use as a planning year in order to be ready for a 5-year new period for strategy for the next strategic plan, which will be from 21 to 25. We have a theory of change which articulates the objectives that the partnership will deliver. It focuses on it focuses according to the 4 functional areas of analysis, alignment, advocacy, and accountability, and then the 6 thematic work streams, but includes also what in the EVEC results framework is called shared deliverables, which is very much looks at increasing funding, increasing commitments, and increasing aspects in the health system that are important in order to strengthen the universal health coverage, but also the system to deliver and transform. Here is the summary of theory of change. The parts that are white are really the EVEC partners framework, and the parts that are shaded purple are our contribution to then the EVEC framework. So everything that is in purple, which is either thematically in accordance to ECD, Adolescents, QED, SRHR, empowerment, or humanitarian fragile settings, is related to the correlating thematic areas in the EVEC results framework. Then we have also at the bottom cross-cutting ones that are more related to the shared values that are cut across in the EVEC. So that too has really relates to not only results, but it also depicts how we will play our part in PMNCH towards the EVEC framework and the EVEC movement. Delivering the business plan, we have spent a lot of time, not only last year but the year before, in understanding how we can, as a partnership, become more powerful and more effective, and therefore more powerful to each other. We have looked at how we could be more partnership-centric and achieve more together than alone. So I think we have a rule in PMNCH that all deliverables need to pass the test of not duplicating any other partner, or being more useful to several partners in realizing that we can come together and do more together than any one partner can do alone. We focus on convening, providing a platform to partners to discuss and agree on ways to align their existing and new activities, and brokering, fostering knowledge exchange, innovation, collaboration among partners, etc. Then we're very much driven by country demand and regional priorities. So it's not only country demand, but also country need, and this can be also articulated from the different constituencies, and not only government. We have, as Anne identified, that we have, although we promote the continuum of care, we've adopted much more of a life course approach to improve women's, children, adolescent health and well-being, and within a universal health care framework, but also very much putting women, children, and adolescent health at the center of the PHC. For those of you that were a part of the Astana consultations at the end of October, where the Alma Ata 40 was discussed, very much looking at how women, children, and adolescent health are at the center of PHC, UHC, and also at the human capital initiatives that have been designed in this year. So, as I've said, PMNCH does not replicate or duplicate or displace any of the partners' activities, but instead enhances in some way or another that is actually defined by the partners. So the partners are supported by a small secretariat, which is hosted by WHO in Geneva. So our country-based work, many partners and constituency networks are based at country level, at local and national organizations, as well as country-based teams of global partners. So these partners are best positioned to support national and priorities, efforts to achieve the global strategy, objectives, and targets. So the way that we try to support and strengthen meaningful engagement is to supporting and promoting multi-stakeholder engagement, strengthening and aligning accountability processes, enhancing multi-sectoral linkages, and supporting joint advocacy and facilitating learning and exchange across countries. And so the ways that we do this is very much working through working groups and committees. There is a host of them in the last annex of our business plan. And that's something that we could also make available, Sarah, for everybody to have a copy of our business plan so that you can look at it more in detail. So currently there is about approximately 30 multi-partner working groups. Some of them are short-term, other times are more long-term. But they very much relate to either thematic focus or function related and aimed at governing PMNCH in its operations. So this is the executive committee or the board or the governance nomination committee and the like. So this is more of permanent structure. And that was really my last slide. What I could say a little bit is that we have been looking at PMNCH in order to enhance our website more and make it more interactive, and this is something that we're working with WHO because we are dependent on their website, and so and that has had some limitations, but now they are upgrading their website, and so we are a part of the first group that is going to be upgraded. We're looking at ways of doing it more interactive so that we can not only dialogue to but also with our partners, and that can be used much more actively and relevant for our partners. The other thing that we have established is really much more in our political engagement strategy. We're looking at how to use champions more effectively in really cascading our efforts. There's also an effort ongoing right now to analyze all of our partners at country by country, which will also give us much more intel on who's our partners, what are they doing, how are they connected to each other, and so forth, because then we can strategically be much more relevant in moving in the direction of how do we draw on partners and use them more effectively in order to achieve more strategic goals. So I will end there and pass the baton to the next speaker.
Thank you so much, Helga, for taking us through where we're headed as PMNCH. For those of you that haven't seen it yet, there is a link in the chat box to the PMNCH business plan for 2018 to 2020. If you scroll a little higher in the chat, you will find a link to the strategic plan, which is the more overarching, encompassing one from 2016 to 2020. But the one that references, or the one that tells you more about what is going to be happening in the next couple of years, would be this business plan from 2018 to 2020. So now that we've had sort of the big picture and the vision and the mission and how are we structured and where are we going, and I'm sure you're asking yourself, okay, what does this really all mean? How does this really work? How does this really help me in my organization? And how can I help advance the agenda with PMNCH? So we thought we would give each of the speakers a chance to answer those questions. So we'll have an opportunity now to hear from Gigi, who leads the Adolescent and Youth constituency, and then she'll hand over to Anne and Helga, and each of them will share their story, their perspective of why they became a member, how it has helped them in their work, and how they have helped advance the work of their constituency or the goals of every woman, every child more broadly. So Gigi, over to you.
Hello, everybody. Good morning, good evening, or good afternoon, depending on where you are, which part of the world. I hope that you can be able to hear me. So my name is Gigi, and I'm from Botswana. And many of you who work in health would remember that a little over a decade ago, my country had the dubious distinction of having the highest HIV and AIDS prevalence rate in the whole world. And many of us, all of us in Botswana were affected by this. And I remember I was still in school at that time, and I was looking at our president at that time, and he was appealing to the whole nation to help with the HIV and AIDS response. This is by spreading positive messages, reducing stigma, or helping orphans and vulnerable children who were left behind as a result of AIDS-related deaths, and so on and so forth. So that is why I started my organization. It was basically to respond to, to contribute to the HIV and AIDS response that we had at national level, but also to help orphans and vulnerable children who were affected by HIV and AIDS. So as earlier on, Sarah said that I am a philanthropist. When I started my organization, it was mainly to do philanthropic work or humanitarian work. So we would provide clothing, food, money, and so on and so forth for orphans and vulnerable children across Botswana. And over time, as an organization, as we evolved and gained more familiarity with human rights issues and also working across the different districts in the country, that's when we realized there are also a lot of human rights challenges that we needed to advocate on. There were gaps in terms of accountability for some of the commitments that our government has committed to in terms of delivering better health care for children, for adolescents, young people, as well as women in the country. And we also saw opportunities in which we as an NGO can be able to partner or collaborate with the government and other development agencies to help them better or more efficiently reach out to adolescents and young people and women with some life-saving education, interventions, as well as commodities whenever we have the capacity. So that is basically how I started my NGO in the country. And I think in 2015, that's the first time I came across the Partnership for Maternal, Newborn, and Child Health. And at that time, that's when the consultations for the new global strategy on women's, children's, and adolescent health consultations were happening. And I was part of the consultation in South Africa, supported by UNFPA because of the Africa Youth and Adolescent Network on Population and Development that I belonged to. At that time, I was leading on the demographic dividend thematic committee. So that's when I first came across the Partnership for Maternal, Newborn, and Child Health. I believe at that time they were still trying to do an adolescent and young people's engagement strategy. And the chair for the PMNCH at that time was Mama Masha Michelle, who is a strong proponent of youth and adolescent and youth engagement, and she really pushed that adolescent and youth should not only be mainstreamed into the other PMNCH constituencies, but should also be a standalone constituency. So that's how we came to have the Adolescent and Youth constituency as part of one of the constituencies for PMNCH, and we had two board members, which is myself and another young woman, Tikala from Malawi, as the board members representing the AYC in the Global PMNCH board. And ever since the AYC has been established as a constituency, we've had so many significant milestones, and I think they're really exceptional given that we are quite a young constituency, but we've been able to achieve a lot of things and contributing towards the broader PMNCH adolescent health and well-being portfolio. And just maybe to highlight some of the key initiatives that we've had as a constituency successfully under the PMNCH Adolescent and Health and Wellbeing portfolio, which focuses basically on 3 pillars for work. The first pillar is evidence for action, which focuses on promoting and synthesizing new adolescent and youth research findings for action and results. The second pillar is empowerment and accountability, which speaks to equipping the SDG generation with the skills and tools they need to be agents of change at local, global, and even regional level. And then the last pillar is on scaling up adolescent and youth action for social change, and this speaks to enabling youth-led advocacy and accountability to drive social change. So some of the key activities that we've had under each one of these pillars of the portfolio is that under the pillar of evidence for action in 2016, we had a knowledge summary, Act Now for Adolescents, and we had representatives from the AYC who were meaningfully engaged in developing that, and this was shared, the feedback from that was shared at different platforms, including at the Women Deliver Conference in Copenhagen, and we've been able to raise awareness about it at different high-level meetings, including the IPU Assembly that was held in Dhaka in 2017 in front of about 1,000 parliamentarians from all over the world. We've also had an AHA framework, and so AHA is the Accelerated Action for Health Among Adolescents technical guidance that was developed by WHO to help different countries with life skills education interventions at the country level, as well as to support country implementation and efforts to strengthen the quality of adolescent health and well-being programs. So we had about 5 members of the Adolescent and Youth Constituency being part of the advisory committee that was developing the AHA framework, and even at the sub-regional level in the context of Africa, we had the WHO Afro office actually training the young people to be consultants that could engage by different countries when they roll out the AHA framework. We also had one of the AYC member organizations translating this into a comic book for the much younger adolescents to be able to use. And we also have various other activities under the empowerment and accountability pillar of the Adolescent Health and Wellbeing portfolio of PMNCH. And one of our key activities we've been having for the past year is the AYC mentorship program. So what happens with the AYC mentorship program is that we have different partners from different constituencies adopting mentees within the adolescent and youth constituency, and then they as mentor and mentee decide the terms of the mentorship program and the expectations and how often they meet, or how often they will have the virtual mentorship sessions. And this has proven to be really, really effective because we've received a lot of feedback from different young people saying that they've been able to really learn a lot from the mentors rather, and some of them have had opportunities during big meetings like ICFP or the SRHR conference in Joburg earlier this year. They had an opportunity to meet with them mentors for the first time in person. And with upcoming Partners Forum, we do believe that we will have an opportunity to have more mentors and mentee meeting as well. When you look at the top left picture, that is a picture of a young mentee. He's Don from Kenya, and he is with Dance for Life Africa, and he had just met with his mentor when he was in Kenya for the PMNCH conference. So we've had such great testimonials from young mentees and mentors. Still under this pillar, we also had the Advocating for Change for Adolescents Toolkit, which we developed in partnership with Women Deliver. So this toolkit provides guidance for youth networks on the design, implementation, and monitoring of effective national advocacy campaigns related to adolescent health and well-being. It also aims to encourage the meaningful engagement of youth and to drive positive advocacy and accountability efforts to influence national health plans and policy processes at the country level. The center picture that we have there is of Vanella from South Africa, and she's our focal person for this toolkit implementation. And we've had 5 countries receiving small grants in the past year to be able to roll out some key activities aligned to the toolkit. The 5 countries are Malawi, India, Cameroon, Nigeria, and Kenya, and they have been doing really amazing work with engaging the government at country level on certain advocacy messages on adolescent and young people's health. And I think one of the great things that comes out of this toolkit is that it really promotes that partner-centric approach of the PMNCH, but at country level, where we say as youth networks, it's important that you work together in all your interventions and complementarity, and then also reach out to some of the PMNCH members that are working at country level to support some of our interventions. And this is an effective way, because we had given them seed grants to do this for the first year. But the hope is that, the vision is that in the next year, they'll be able to reach out to some of the PMNCH partners that are present at country level to help them with rolling out some key activities in the next year. And those activities would also include maybe translating the toolkit into a local language. And then maybe the last example to give out of that pillar is on transforming accountability for adolescents. So as many of us might know, that the Independent Accountability Panel report was focused on transformative accountability for adolescents, and they had some really key and very important 6 recommendations that were very helpful to our work. So one of the things we have been doing is also amplifying the 6 recommendations that came out of the IAPP report during different engagements that we've had as AYC, and also pushing for pushing to have more of our partners at country level also engaging with the governments and leaders on these key recommendations to sort of popularize them. And then on the last pillar on scaling up A&Y action for social change, key activity that we normally capitalize on as AYC under this pillar is number 1, building and strengthening coalitions for a more cohesive and unified movement to drive youth-led advocacy and accountability. This is at the local, at the regional, as well as at the global level. Second one is strengthening national coalitions for youth-led accountability for women, children, and adolescent health. Establishing or strengthening multi-stakeholder national platforms that ensure meaningful engagement of adolescents and youth to advance policies on adolescent health. Establishing digital health platforms to enhance policy, service delivery, and a financing mechanism for women's, children's, and adolescent health. And lastly, building multi-sectoral country-specific campaigns to improve adolescent and youth health and well-being. And we've had some really exciting activities under this. One of the things that we do as a PMNCH AYC is that we do support engagement of young people at different high-level meetings or high-level platforms at regional and at global level, so that young people, we have a platform to engage with our leaders. Many times for young people, it's very difficult for a youth organization or young people to have an audience, for example, with the Minister of Health or a leader and so on and so forth. But with PMNCH, we've been able to provide platforms where leaders can actually engage with their leaders, the ministers of health and so on and so forth, just to be able to raise awareness of the work that they do at country level, and also foster accountability. And one of the successful ways we've had that is through the intergenerational dialogues that we've hosted at the UN General Assembly between ministers of health from different countries and youth activists from those countries. Also in Malawi last year during the PMNCH meeting, we had a very successful Strengthening Adolescent and Youth Coalitions in Malawi initiatives. That was a build-up to the actual high-level meeting that that featured the president of Malawi. And one of the things we want to do in the next coming year is that we want to provide seed grants to different organizations across the world to be able to build coalitions in country with other networks that are working on maternal, newborn, sexual reproductive health at country level. So this is something we'll be doing, and also leveraging on the partners that are also part of PMNCH. So that is what the those are some, a lot of things that AYC has been doing, but I thought I should just highlight just those key things. And those who are also on the call, because I can see a couple of people here from different countries, if you know of youth organizations, networks in your country or just around your area of work that you think would benefit from being part of the AYC, please go on the PMNCH website and you will have an option on how to become a member of the Adolescent and Youth Constituency, and we will be happy to work together in transforming or bettering the lives of adolescents and young people all over the world. Thank you very much, Sarah.
Thank you very much, Gigi, and I'm already thinking of my questions that I am going to start with you on, but we will first go to Anne, and I'll take this moment to remind the group that ask your questions in the chat box. After these testimonials from Anne and Helga, you'll get to ask questions of our presenters. Anne, over to you.
Great. Thanks, Sarah, and thanks, Gigi, for that fascinating and comprehensive overview of your engagement and the very exciting and far-reaching work of the Adolescent and Youth Constituency. So I'm just going to do a couple, actually, I think 3 slides, and I'm going to start with this one that's back from the 10-year strategy. This is from 2007, so near the beginning of PMNCH's existence. And I just wanted to share a little bit about some of that history. I talked a little bit about how the partnership, when it was first established, was a bringing together of the maternal, the child, and the newborn health communities. I think one of the things that was really striking to me, and one of the reasons I was so interested in being involved with PMNCH, was that, in fact, at that time, there were really, it's almost hard to believe at this point, but there were huge divisions between these 3 communities. The maternal health community, safe motherhood community, really did not engage with the child health community. Newborn health wasn't even really on the agenda. And there were issues. There was competition between these 3 communities. There were different approaches, different priorities, community-based versus infrastructure-based health services, et cetera, et cetera. And what PMNCH did was that by providing this platform, by creating this platform that brought these communities together, it enabled that exchange, that learning, and honestly, to a significant degree, that interpersonal connection. I will tell you honestly, coming from the maternal health side of the agenda, that initially, when I first met with the activists and advocates and researchers from the child health community, there was sometimes real tension and real disagreement. And within a year and a half of PMNCH being established and of us working together, we were really finding common ground, understanding each other's issues, and most importantly, understanding how by bringing our voices together and bringing our communities together, we would be able to strengthen the impact of our own work. So there's a lot more I could go into there, but I'm going to leave that. The second slide and the second comment I wanted to share, which is around how being involved in PMNCH can help my organization or the objectives of my organization. And I just wanted to tell the story from earlier this year of the Guttmacher-Lancet Commission and its report on sexual and reproductive health and rights that was published by the Lancet in May of this year. So we had the first launch event for this Commission report was in Johannesburg, but then just 10 days later we had an event at the World Health Organization, at the World Health Assembly in Geneva. And PMNCH was such an incredibly valuable partner, really in some ways a lead partner for this particular event. They provided all the logistical support of finding the venue, organizing the speakers, putting together the materials, et cetera, and were such an important voice in amplifying the messages of the Guttmacher-Lancet Commission report on sexual and reproductive health and rights. So there was that specific work around the event, but it's also been critically important, PMNCH's role in doing exactly what we've talked about, adding this as the fifth A to what PMNCH does, which is to amplify. PMNCH has recognized, as you saw earlier, that SRHR is one of the 6 core thematic areas of work. The Guttmacher-Lancet Commission report on SRHR fits very nicely within that core area of work, and so PMNCH, rather than trying to duplicate or replicate what the Guttmacher-Lancet Commission has done, has picked up those core messages around the importance of sexual and reproductive rights, around the essential package of SRHR interventions, and is using that and integrating that into PMNCH's own work plan. So it's been hugely beneficial, obviously, for Guttmacher, because it adds a huge amount to the reach and to the credibility of the work of the Guttmacher-Lancet Commission. And of course, it strengthens the work of PMNCH, because being able to build on this groundbreaking resource that was published in the Lancet helps to strengthen, the reach and the impact and the credibility of PMNCH's own work. The last comment I wanted to share was around how has active participation in PMNCH helped the constituencies that I have represented. Of course, over the 13 years that I've been part of PMNCH, I've represented 2 constituencies, the NGOs and then the academic research and training institutions. These are the 2 largest constituencies in PMNCH, and I think it's important to acknowledge that can sometimes be challenging, that as the partnership grew in size, that organizing a teleconference or whatever for these constituencies is no longer feasible. But nevertheless, active participation in PMNCH, being on the board, being in the working groups and committees, participating in the various partners forum and other events at World Health Assembly, in UN, during UN General Assembly in New York. This has been invaluable to both of the constituencies that I've been part of. I think it's important to recognize that PMNCH is, in my experience, unique among the global health partnerships in having such a strong and diverse civil society membership. Most of the global partnerships that you see, like the Global Funder Gavi, have one constituency for civil society organizations, for civil society representation, with a relatively limited number of seats, but PMNCH has several. There's the NGOs, there's the academic research and training institutions, there's the healthcare professionals, there's the adolescents and youth, which are not necessarily NGOs or civil society, but many of them are. And now there's the intergovernmental organizations. Convening these constituencies and enabling them both to engage with other organizations within their constituency, as well as with other constituency representatives, to establish and strengthen relationships, to plan collaborations, sometimes to negotiate funding for collaborative work, have been just some of the many benefits to the constituencies of being part of PMNCH. So I'll wrap that up and turn it back over to Sarah for the next comments.
Thank you very much, Anne. Our last testimonial before we get into the Q&A is from Helga, who is leading the PMNCH Secretariat. So Helga, I will unmute you and make you presenters in just 1 second.
Okay.
Oh, there you go. Start as you are ready.
I was talking. So thank you for that. So my testimonial is from the time that I was part of the Norwegian government, and it was 2007, and we had been able to convince Norway and its government and its prime minister that MDG 4 and 5 were really in trouble, and if we didn't do something seriously about it, then it would be definitely no progress in there. And at that time, I must just tell you that there were many countries that were in total red. Some countries had even worse numbers than they started off with in 2000. So this was a serious situation. And so our Prime Minister, he reached out to several of his peers, Canada, UK, Germany, U.S. And there was a network of global leaders, and so there was some brewing of yes, this is in recognition of that this was an important area, and we also at a point went and visited Ban Ki-moon, the UN Secretary General at the time. And so what happened, which is really, well, let me just tell you, what then happened was that there was recognition, and there was an acceptance that, yes, we should focus on this, and so should others. And before we knew it, there had come a lot of initiatives mushrooming up. The UK launched its International Health Partnership, Global Impact for Achieving the Health MDGs. Norway launched the Global Leaders Network for MDG 4, 5, and 6, and Canada launched Canadian Catalytic Initiative to Save a Million Lives, which was really focused at the time on child health. So that was really positive, but we were in trouble, because the benefits was that there was an increased focus and action for MDG 4, 5, and 6, increased commitments by high-income countries to low- and middle-income countries increased. There was a more recognition of dialoguing with low-income country and the bilateral and donor and overseas assistance. But the challenge was donor coordination in one country plan was a wishful thinking, and also there was a lot of silo, a lot of vertical. There wasn't really this, how do you contribute to the health systems, and who's, how can you maximize on aligning financing so that it really contributes and strengthens the broad base. Then there was this long-term predictability or result-based financing, which also was in trouble, because it was like there was such enthusiasm. There was this really gusto of short-term planning, and also this really focus on result-based financing without kind of thinking about okay, how does this relate in context of a long-term financial predictability, as well as strengthening on a long-term basis the system. Then there was this issue about, there was such just enthusiasm in some ways, and it was going in all directions, the role of the state, and how can we ensure that domestic financing is really something that it gets focused on. What about private sector financing? What about private sector engagement? And what about, a multi-stakeholder platform or engagement more so? And then there was this big issue of, is this really new money, or is this reallocated, rebottled money? And what happened at the time is that, this came into, there were comments, there were critiques, academia started writing about this, and all of a sudden something very positive turned not positive. It turned like the development community and the community at large did not really know what they were doing. It was really haywire, and this was maybe we were at a fear of doing more harm than good. So this is when PMNCH's platform became very useful, because then it was something that one could go to and then say, hey, this is several constituencies here. This is also several members within the constituency. Let's sit down and agree on how to move forward, rather, wisely than quickly and short-term with short-term benefits. So one did that. One got the UN Secretary General. One was able to really use the platform with several constituencies. One was able to really harness the wisdom of the different constituencies and then come with something that was common. And this was the Global Strategy for Women's and Children's Health in 2010. And this was it's the first time we've seen across the board agreement on how we approach women's and children's health. It was something that the UN Secretary General, I must tell you, reluctantly, was unsure of when we approached him. But when he left, said it was one of the 5 most important things he had done in his tenure. And he also then was very eager to take and use his voice to this, which was very helpful towards all of the other heads of state in the world. Then there was a UN statement. Then this really was not only were we able to get consensus around alignment of the essential interventions, of the continuum of care, but how the continuum of care was positioned within the health system and how we contributed to strengthening the health system, and also everyone in the community and the constituencies had an important role in what their approach was. So it enabled us to be much more organized, much more aligned, and really, to be honest, much more powerful. It said that we were able to mobilize 60 billion, of which at a point at 2015, 40 billion were already dispersed. So I think in some way we would not have been able to do this without that kind of a platform that PMNCH contributed to, and which we took with us to 2015, because in 2015 we were able to not only assess the progress that was made, and the progress showed that the increased commitments and increased progress in outcomes from the last 5 years in the MDG were much more than in the previous years of the MDG era. So this had indeed really resulted in that more coming wisely and more strategically together can benefit and have better effects than if anyone went into multiple silos. So I think in some way this then we took progress, and this led into the new strategy, which is existing and we should get a copy of, is the new global strategy, which then built on the, as I've said earlier, on the unfinished agenda of the MDGs on equity, quality, and also rights, and also areas that needed more attention. So this was something that really took us then to the in the SDG area and more united. And I must tell you that when we were negotiating, excuse me, when we were negotiating for the indicators for our area in the SDG dialogue, boy, had we done our homework as a community, because we had more indicators that were evidence-based, more indicators that were really put into system monitoring. We had more evidence as it related to cost effectiveness, and we had more evidence as it relates to the investment case, which really was valuable and critical in order to getting so many indicators in the SDG document itself. So that's what the benefit has been for PMNCH. It's been really powerful. and it has also been extremely important in order not only as a document, but in the implementation. I think the UN Secretary General has been thanked so many times for his leadership in this, but equally so are every single constituency and member that stepped up and played its part for implementation. And so that's why I think this is a successful equation and successful formula and a successful model that we should really harness and get behind in order for women, children, and adolescent health to be critical and important in the future. Thank you.
Thank you very much, Helga, Anne, and Gigi. And thank you for your testimonials and your time sharing the history and mission of PMNCH. I know I certainly have learned quite a few new things in this past hour as we discussed. We are now moving into a time of Q&A where you as participants can type your questions in the chat box still, or you can, there's an icon, if you'd rather speak your question, you have a comment you'd like to say, there's a little icon of a hand just to the right of your name in the participant list. If you click on that, that lets me know that you have a question for our panel. I am going to give you a minute. I'm going to take advantage of the minute while you think of your questions and ask one or two of my own. You have had inspiring stories of initiatives that you have accomplished through PMNCH. And there might be people on this call that have never initiated a conversation with their PMNCH constituency before. So Gigi, I'm going to find your name and unmute you. I'm looking for, if somebody on this call has an idea and they're thinking, I would like to be an active partner in PMNCH, and I want to move forward with this idea in partnership with members of PMNCH, what are some of the practical steps of getting started? You've certainly had some successful partnerships through PMNCH, so if I have a new idea, how do I get started? What are some of the practical first steps? Gigi, I'll pick on you first.
Great. You're saying practical first steps to become part of PMNCH?
Or to move an idea for like an idea for a new toolkit, or if there's a need to say, I'm not going to do it on my own or with only my organization. What would be some practical first steps to engage other partners in PMNCH?
Yes, that's great. I think, first of all, an important thing is to recognize that there is really strength in numbers. I know it's a cliche, but it's really very true that there's more strength in that if a lot of you are speaking the same voice. So I think the first thing is to pick what is it that you want to do, what is it that you want to work on. Let's say maybe you're saying, I want to work on comprehensive sexuality education and want to push for member states to incorporate CSE in their curriculum at different levels. So the first thing you do is that identify partners who also work along the same lines or will be able to support your focus area. Once you've identified organizations, maybe let's say you're saying maybe Save the Children would be able to work with me, the White Ribbon Alliance would be able to work with me, maybe UNFPA because they work on SRHR, they would be able to support me. You identify those partners and then reach out to them. This is way before you even start the intervention. Reach out to them and say, this is what, as an organization, as Huantlajang, we would like to be working on CSE. These are the approaches that we think we could strategically work on to engage the government and other members, and then work together in developing a certain position, work together in developing consistent messaging around the same issue, and then after that, especially at country level, one of the things that I realized is very important is after you've developed that as an NGO, as UN agencies and development partners, try to reach out to leaders who could be your proponents. Leaders could be MPs, could be traditional or religious leaders, just people who are influential in society who would be able to amplify your messages. Like in the context of my country, one of the things that we did when we were advocating for the age of consent bill to be revised is that we went to the youngest member of parliament, who is a 30-year-old young woman. So because as NGOs, we make noise, we raise awareness, we sensitize people, we needed somebody who would be able to push this as a motion in Parliament for debate. So aligning with this young MP helped us because she had access to power and could table it as a motion in Parliament. So I think aligning to somebody who's influential and powerful to be a proponent for your cause is important. And then lastly, multimedia is really important. In this day and age, if you're going to do something and you do not digitize it, there is really very little impact, because the media is important. It's an important tool because it reaches out to the masses, and you're able to mobilize more opinion on a certain issue, mobilize more support around a certain area in a much shorter period of time. So if you're going to be doing any sort of intervention engagement, make sure you have a communication strategy in there. Make sure you use the social media or multimedia tools that are available to you, and make sure there is consistent messaging, because issues of health are very sensitive and in many cases they're controversial. So having consistent messages as partners, as NGOs, as a partnership, or as a constituency is very important. So I think those would be the fundamental first steps.
Thank you, Gigi. And perhaps we can build on this question with some of your input as well. Thinking back on some of the successes you've had in your testimonial, but also with your viewpoint, looking at PMNCH successes of other partners coming together, what have been some of the best practices that we learned about partners coming together to achieve PMNCH goals? What makes a successful partner and partnership within PMNCH?
Thanks, Sarah. Well, I think Gigi has laid out some of the really important basics of that. I'm just thinking of some of the other examples. Probably one of the most impactful ones that PMNCH has been involved in, which came from, in fact, the Academic Research and Training Institute's constituency before I was part of it, was the effort to put together a guideline on the essential interventions for reproductive, maternal, newborn, and child health. So the ART constituency, really led that effort, reached out to, in particular, WHO. So they, acknowledged, of course, WHO's critical role in providing guidance to countries, but said, we think that we as a constituency can contribute to the thoroughness, the reach, and the credibility of this effort. Let's put this together. And then they worked over a number of consultations, did a lot of analytical work, held a lot of discussions, and then produced a report that was co-branded by PMNCH, WHO, and one of the academic institutions that had been leading on this effort. So I think, just to be specific about one of the things that Gigi mentioned, it's important to start within your constituency and get allies, but once you have at least some critical mass, some number of allies and partners identified within your constituency, of course the whole point of PMNCH is the value added of multiple constituencies, of multiple partners. So then reaching out to other constituencies to say, hey, let's work together on this, our voices will be stronger and have a greater impact if we work together. So I think recognizing that value of working in partnership, of, as we said, of PMNCH being not just partner-centric but partnership-centric, to really focusing on the added value of that kind of collaboration, and recognizing that and in kind of internalizing that behavior in our own work. We all want to promote our own organizations and our own issues, but as we all know, part of working in partnership is also compromising and adjusting. And I think PMNCH is a really good platform for learning how to do that and the value of doing that.
Thank you very much, which is leading me into building question for Helga. Helga, we've talked about some of the best practices of partnering and partnership with PMNCH. One of my questions we have to address as a community of partners are, what are some of the challenges of PMNCH has faced in bringing partners together to work on shared goals? You've talked a little bit already about moving forward, we need a better understanding of which partners are working in which countries. What are some of the other challenges within the partnership of PMNCH that you hope active participation and more active partners can help tackle?
Thank you for that. So, you know, when we started in 2005, I think there was less than 50 partners in PMNCH, and you know, then email works pretty well. But now that we're over 1,000, I think we really, and maybe our partnership needs to be 1,000 times that in order to be really powerful. And so I think in some ways we need to think about new methods of not only communicating but also engagement, and so analyzing better who are our partners at country level, what are they doing, how are they connected. This is something that we've started putting in place. The other thing that we've started putting in place is kind of a plan for, I think our business plan says 5 to 10 countries where we really need to analyze or develop a kind of an advocacy roadmap of strategically what to do in the next 24 months, and so also communicate to partners how they can get engaged, or how and not only how they can get engaged, but also how to for them to tell us, because you know it is through our partners that we learn what is most strategic. So in some ways it needs to be a dialogue, it needs to be a partnership, interactive, two-way, building on looking at how can we get better information quicker and act on it together. And so I think the multi-stakeholder platforms that we plan to support in country level, I'm hoping that can very much be that. But also what, as Gigi was alluding to, we have small grants. They're not only to adolescent and youth-led organizations, but also to civil society and other civil society, which then includes healthcare professional associations and all of that. So I think we need to be much more strategic in the way that why do we need to partner, and who needs to be engaged, how can they engage, and so forth. So what the challenge has been in the past is that we have not been strategic or clear in our communication in how you can get engaged, when and for what in some way, and how can you feed that information as a partner to us as a platform, so that that can really be more effective in moving forward. But the business plan is very much about that. Talks about digital health, talks about also ways of interacting and improving information. And these webinar series are also part of it. And there can be community of practices. There can be different things that we're going to look at in order to put in place.
Go ahead, Sheila. There you go.
Thank you, Helga. Thank you, Anne. Thank you, Gigi, for taking us through the journey of PMNCH today, and for sharing your experiences and ideas for the way forward. Renee, I see your question in the chat. Unfortunately, we are at the end of time, so I've made a note of it, and perhaps we can follow up with you offline on your question. This is the last webinar of the webinar series. But we hope that if you haven't seen the previous webinars, that you'll have a chance to go back and watch the recordings. You can find those on partnersforum2018.com. The recording, the slide presentation, and the links that we shared in the chat today, all of those will be up on the website later this week. If you are joining us in Delhi next week, we will see you there. If not, please do join us online. Follow us on Twitter, on Facebook. Use the hashtag 2018 PMNCH Live. And stay tuned to the virtual forum on the webinar series so that you can find out about more on what we're doing for the live streaming and what you can do as part of the virtual side events to start a conversation ahead of the forum on issues that are of interest to you. So again, a big thank you to World Vision International for being our co-host for this webinar series. This is our first series that we've hosted, and we're hoping to have ideas from our partners on what we can do in the future going forward. If you like these webinars, if you want to see more, feel free to send us an email. Tell us what you think would be of interest. Tell us what you'd like to do. And if you'd like to become a member and get more involved, all of that information will be in the website later this week. So once again, a big thank you to Anne, to Helga, and to Gigi for your time today. Those of you that have colleagues that are in other parts of the world, there will be another webinar on the same topic later today at 2 p.m. GMT. But you can always send them to the recording, or you can forward them the invitation and ask them to join us live later on today. So a big, big thank you to everybody, and have a great evening, morning, and afternoon. Bye.
Thank you. Bye.
Thank you.
Bye-bye, everyone. Thank you for participating. Gigi, Helga, and Anne, I'll see you online in a few more hours.
Thank you so much for good sharing.